Imagine standing in the midst of foreign battlegrounds. Chaos swirling all around you as a U.S. Special Operations soldier under relentless attacks by local militia. In your hands, the shoulder-fired Carl Gustav M3 rocket launcher is your lifeline. Each launch, vital for your defense, also unleashes powerful shockwaves that surge back at you with every blast. These waves penetrate deep, sometimes risking traumatic brain injuries that could lead to severe impairments. But that is the risk you take for your country and for your own survival. Mike Lahith is the CEO of Zero Eyes, a company that integrates AI technology with security cameras to detect weapons and enhance public safety.
Know what the shooter looks like, know what type of weapon they have, and geolocate them on a map so we could focus on decreasing response times to save lives.
I was a U.S. Navy veteran with 10 years of active duty, and 6 of those years was in the Navy SEAL teams. Multiple combat tours over to Afghanistan. I was a breacher, heavy gunner, point man. Many different jobs as a normal in the SEAL teams. After I left active duty, you see it was a lot of operators and operator syndrome, whatever you want to call it. Everything from lack of sleep to your hormone levels being out of whack, which leads to a lack of sleep, and then you lost that feeling of community, but then taking blast injuries, breacher brain, etc., and it all kind of compiles on each other, and you feel like you're carrying the world on your shoulders.
In his quest for healing, this former Navy SEAL grappled with a tangled web of medical red tape.
Go to the VA and you have to go get registered for a blood test or a CAT scan or whatever here. You might have to wait 3 months for the one appointment. Then you get another appointment over here and it's with another doctor.
Fortunately, Mike found his way to the Marcus Institute's Optimal Brain Full-Day Assessment. The program combines the most cutting-edge assessment technologies with innovative and proven approaches to support healing and recovery.
Would you recommend the program to others?
100%. Already have. If you have the opportunity to go, find the time and just make it happen and do it. It's 100% worth it.
When I think about heroes like Mike, a pressing issue for me is that not enough doctors and other skilled health providers have the kind of training that makes the Marcus Institute unique, and that is a problem I am committed to solve. Hi, I'm Dr. Dan Monti from Thomas Jefferson University, where I established the first ever Department of Integrative Medicine and Nutritional Sciences at a U.S. medical school. Our department includes the Marcus Institute of Integrative Health, and our mission is to elevate the medical model with innovative solutions to health challenges. The pandemic shined a spotlight on a growing healthcare crisis of tremendous psychosocial suffering in this country, making our calling to explore revolutionary therapies more urgent than ever before. Welcome to the new frontier of medicine. Your new, healthier life begins now. Hello everyone, I'm Dr. Dan Monti from Thomas Jefferson University's Marcus Institute of Integrative Health. The story you just saw is just one of countless patients who have significantly benefited from integrative medicine. Over the years, this personalized approach has allowed us to partner with patients on their healing journeys and see them experience a rebirth of health. I have witnessed how our precision assessments unravel the root causes of some of the most complex issues. And I have personally experienced, in myself and in my patients, how the targeted therapies we offer in combination with standard medicine can transform lives. The additional treatment options we offer are far-ranging and guided by the comprehensive assessments we do. Sometimes we draw upon the wisdom of ancient healing systems, one of which influenced my thinking about the world early in my career. My journey into integrative medicine and integrative health is really an interesting one from my perspective. I was a medical student and struggling with headaches and severe tension in the back of my neck that I think culminated into a headache. And it was impairing my ability to function and really study the way that I needed to. I was taking handfuls of things like aspirin every day, trying different techniques, but nothing really was doing it. And it really started me on my journey of understanding and exploring things that go outside of the conventional model that I was learning. I knew the information in medical school that I was learning every day was critical and that I needed to know it, essential for understanding disease and the human condition. But there was more to health than understanding disease. And that's what some of these different models I started to learn about taught me, including traditional Chinese medicine, but also nutrition, something that we don't learn much about in medical school. After years of hard work and incredible support, my passion for integrative medicine has turned into something truly groundbreaking. In 2019, we launched the first ever medical school department of integrative medicine and nutritional sciences at Thomas Jefferson University. And it includes the groundbreaking Marcus Institute of Integrative Health. I was privileged and honored to be the founding chair. Working alongside some of the brightest minds from around the world, we've tackled complex medical mysteries and trained a new wave of doctors. I mentioned the late great Lena Horne. It's not the load that breaks you down, it's the way that you carry it. Educating the physicians and healthcare providers of tomorrow was essential to me and my close friend and partner on this journey, Dr. George Zabrecki. It is also a key prerogative for our tremendous benefactor, Mr. Bernie Marcus. For us to train and educate talented healthcare providers to extend and expand the model we started has become a critical mission.
These are very hungry brains, and they're scientific brains, and they have so many dots to connect, but they have the fundamentals so that their learning curve is so much more rapid than the doctors that I'm used to meeting, and they certainly take it to the next level.
Dr. Zabrecki is the academic director of the Marcus Institute and also key faculty in our department.
Anytime you try to force the immune system, you get a rebound. You get an improvement in one area and a problem in another. You can see this in the current therapies.
His innovative way of thinking about and teaching complex issues such as biochemistry and how it relates to immune physiology, organ system function, and so on, is truly a gift.
I always wanted a situation where I could teach as aggressively as I wanted to. And sometimes that wasn't allowed. But in this situation, the truth is the truth.
What really is the truth in this context? What insights are medical professionals seeking? What are the gaps in their training that our new model of care can fill? Let's first hear from two of the Marcus Institute's fellows in integrative medicine, Dr. Natalie Kahn and Dr. Janelle Blocker. These are physicians who completed their primary specialty training, who are now getting full-time subspecialty training in integrative medicine.
I felt like there were a lot of gaps in my education during my traditional training. I was finding that patients needed more support than I was able to give them with the traditional model.
Back in my third year of psychiatry residency, when I realized that there were several patients who either could not or would not take psychotropic medications for various reasons, and they still needed treatment.
I wanted to learn more, and that's where I found integrative medicine.
It's delightful for me to see how the fellows, when they come in, well, they're coming in with eyes wide open. Otherwise, they wouldn't be with us. They are curious, all of them very intelligent and accomplished, but they're also not locked into a box of conventional medicine. And that makes it so delightful for us, or for me, to work with them, because they're all incredible human beings who want to make a difference in the world.
In addition to the full-time fellowship for recently graduated physicians, the Marcus Institute and its academic department have created at Thomas Jefferson University a master's degree in integrative health sciences. This degree program is a good fit for physicians who are already in practice, and also for practicing health professionals such as nurses, physician assistants, chiropractors, and many more.
Working in the hospital was really difficult because you would see patients really ill from chronic conditions, and basically in the hospital we treat them with medications, and there's no information or education on lifestyle changes or how to really improve their quality of life and increase their lifespan outside of administering the medications.
My background was in emergency medicine, so it was much different than what I'm doing here. And I remember hitting this point in my career whenever we kind of went through COVID and patients would come in and they were really sick and they would deteriorate very quickly. So I came to this point of like, there's got to be more that we could be doing.
A physician assistant works in collaboration with physician. We are licensed to practice medicine, to prescribe, to order lab testing and make diagnoses, again, all under the collaboration of our supervising physician. So we differ from a medical assistant who is more responsible for triaging and medication reconciliation and taking vitals and that kind of thing. So we really serve as an extension to the physician in that way.
There's a lot of autonomy too that's allowed with the physician assistant.
Elena and Cara joined the master's degree after they started working at the Marcus Institute under the direction of medical director Dr. Anthony Bazan. We featured him in a previous episode as the medical mysteries expert and a guru on hormonal therapies. Recall his patient Annette, who came in with extreme hormonal dysregulation.
About 15 or so years, I started having hormonal issues. Dizziness, nervousness, hot flashes. I was like jittery, always anxious. I was driving and I had a panic attack. I said, something is terribly wrong.
As Annette's health declined after menopause, Dr. Bazan took a multifaceted approach to her treatment, guided by his careful testing. She had nutrient deficiencies that were treated, a gut microbiome imbalance that was addressed, and hormone dysregulation that was treated with bioidentical hormone therapy, as well as other critical metabolic adjustments. This personalized approach, using comprehensive assessments to get at the root cause issues, resulted in profound improvements. A key medication she needed, in this case testosterone, may have been overlooked in the standard way complicated menopause is treated.
Interestingly, testosterone is very important for women because they don't have it. They don't have enough. And testosterone, when people think about testosterone, they think about a beard and acne. But in reality, what testosterone is a building hormone. This is how osteoporosis happens. This is how sarcopenia happens, meaning the loss of muscle mass, which is the signature sign of menopause. So even tiny little bit of testosterone for women makes a gigantic difference. Also, one of the beauties of testosterone is anti-inflammatory.
Everything bioidentical. And I start feeling better and better. He could not believe it. He said, in my 25 years of doing this kind of surgery, you're one of my best patients. I don't know what you've been doing. Whatever you're doing, keep it up.
That's probably been one of the most astounding things that I've seen with this. We were always taught that once women hit menopause, we're just expecting bone mass density to decline. Genetics maybe play a role, but there's nothing we can really do about it outside of these medications, which can certainly be helpful, but are not without risk and side effect. And so seeing the impact that we've been able to have with hormones is eye-opening. I just saw a patient today who, exactly like Elena described, came from osteoporosis into normal bone mass density. So Wow. It's wonderful, yeah.
The master's degree in integrative health sciences is a robust program with students from all over the country, and most of them are not employees of the Marcus Institute. An example is Courtney Orlando, a student in the master's degree program and a mother of 7, who was a hospital nurse specializing in pain and palliative care before her life was overshadowed by a rare medical disorder.
They put me on end-of-life care. I was on palliative care, then I moved to hospice temporarily.
Wow, it was
serious.
serious.
It was really serious. It was really serious. And through too long a line of events to explain, I'm obviously still here. I did actually code 3 times in that year and those years. And
she came very close to death.
Oh yeah, like literally.
She had reached the limits of conventional medicine, but in an unexpected twist of fate, something tremendous occurred. In those final desperate hours, she was able to harness a healing potential deep within herself, and she underwent a miraculous recovery. Although difficult to explain with medical science, accounts like Courtney's have been documented throughout the ages. This profound experience made Courtney realize that although standard medicine is important and sometimes all a person might need, for many, healing involves much more than a pill or a medical procedure. This transformative life experience ignited her to passionately explore the important other components of healing.
I think that sometimes we have to not know anything to figure out we have more to learn.
In her quest for comprehensive whole person education, she serendipitously came across our master's degree program, and the content deeply resonated with her.
I felt like, does this really exist? Is medicine really advancing? You know, I mean, I was doing it, but I'd never seen it talked about in like standardized, in an academic way that I trusted.
During her master's studies, Courtney continually expanded her toolbox to tackle patient challenges, including mastering a mind-body therapy known as neuro-emotional technique, or NET.
I can take these things, so say somebody comes in, here, I just want to say how vast it is and how you can use it and how creative. You're like, I've been trying to do this and I know I should exercise and I'm so resistant to exercise. Well, maybe they are, you know? And so now I say, well, I have this technique called NET and I think it might be able to help and see if there's a stressor involved, something that was there that's kind of causing that feeling of a block, right? And this is not an exaggeration, 10 out of 10 times it works. I have a client of mine, she is almost 65. She's had multiple fractures through her spine. These are people like, I can't ever recover. Now, we've been working together for almost 2 years. She came in and she was literally said to me, I don't have a plan, Courtney, but I'm at the point where I'm not sure if I want to live. And I said, okay, sit down, so-and-so. And we walked through it. She is now following the best nutrition plan she's ever followed in her life. Her pain is not gone, but it's controlled. She walks her dogs. She's out going on vacations. She just texted me the other day and she said, now we're to the point where she's exercising. She's doing yoga. She's walking a half hour every day. This was her goal, right? I could probably cry when I'm talking about her because if you saw the woman when she walked in my office and you see her now, the lights are on. She's not just better, she's thriving. She's living a life that she thought was impossible to live. And I also I don't always make it personal, I frequently try not to, but sometimes there's those times where somebody needs to look at somebody else and go, you went through what? And you look like what? And you're still here? And I'll say, yes, and it's not because I'm super special. It's because we have access to these lifestyle measurements and this nutrition and these mind-body techniques that can make a world of difference. I said in the beginning, and I'll say it a million more times, and it's not hard for it to just pour out of my mouth. It was the best decision I ever made in my life, ever. Like on a personal level, on a career level, on all of it. It really was. So I would say get to it. Stop waiting because that's not helpful.
People are going to think I paid her to say this. Oftentimes people think integrative medicine is just adding some dietary recommendations or nutritional supplements to the treatment plan, when really there's so much more to it and so much more to teach people about it. As part of the fellowship program, the Marcus Institute now has the ability to even consult with patients in the hospital, something that has not occurred before, especially at this scale.
I think we're providing an incredible service to the patients who are stressed, and they're getting an opportunity, again, to tell their story, because when you're in the hospital, you don't get to tell your story. And when we're coming in, we can offer them things that the hospital cannot offer them. So things that actually help make patients feel, not that they will feel at home, but to get a sense of ease while they're in the hospital, and to make them aware that there are other things out there that can make a difference in their lives, so that they can connect with us once they come out of the hospital. So they can say, we talk to them about nutrition while they're in the hospital. They might not get that nutrition yet in the hospital. We're working on that. But I think it will open the eyes to patients and physicians that there is another branch of medicine.
Founding the first Integrative Medicine Department in the United States in 2019. And now, with more people joining this journey, I've been blessed with exceptional partners who have helped tackle the countless challenges to introducing a new specialty of medicine. Early on when we were doing this, the then hospital president took me aside and said, I get what you're trying to do. I think there's value to it, but it's on you to make sure you do it correctly. I don't want to end up on Nightline, which at the time was a news program that brought up controversial things, and many people were put on the spot on this show. So I always felt like I had the burden of making sure we did things correctly, that we took a scientific approach to things, that when we brought on a new therapy, it made sense.
Can you hear me okay?
It had the right amount of backing to explore, and that we were really thoughtful about every single thing that we did.
This morning, we're introducing you to a form of healthcare and treatment that you likely have never heard of before. It's called whole health or integrative medicine.
Integrative medicine is now beginning to hold a significant place in American healthcare.
One of the biggest medical breakthroughs in decades.
Integrative medicine.
Integrative oncology.
Integrative medicine is
helping countless patients reclaim their lives, reimagining health education for professionals, and pushing the boundaries of science with rigorous research. All of this, in large part, is thanks to someone you might not expect.
I thought about this gigantic store that would encompass everything. I was thinking 50 hammers, 50 kinds of screwdrivers, everything.
Yes, it's Bernie Marcus, the co-founder of Home Depot. His contributions to this journey cannot be underscored enough.
He wanted to save medicine. Medicine has been foundering for the last 30 or 40 years, partially because they practice the same type of medicine for almost a century. And everybody, there are think tanks all over the United States of very smart people trying to develop ways to save medicine, and everything has failed. And Bernie's vision of saving medicine was not to add something to it, but to be absorbed into the integrative model, which would save expenses as well as improve patient care.
Many might think that a billionaire's wealth unlocks every door.
Home Depot today is 330,000 people. I've created jobs in America. I ran a business.
But much more than money was required. We also very much needed the insights and strategic guidance from the kind of person who could build a thriving Fortune 500 company as Mr. Marcus has.
If you're there for them and you're sincere about helping them, you can change their lives, you can have an effect on their lives, and more importantly, you can have effect on your own life. And so that became the mantra of Home Depot.
People like him also know to surround themselves with the smartest advisors, and fortunately for me, Dr. Zabrecky served that role for him when it came to healthcare.
The last department that was accepted into medicine was emergency medicine in the late 1980s. Having a department is not a small thing. We had had 2 fails at 2 other universities previously. We had tried aggressively at Emory, and ultimately the Board of Trustees decided they didn't need integrative medicine. We tried at Harvard, and after 2 or 3 years of trying to develop a program with them, it ended up in arbitration, which Marcus Foundation won our money back.
And then after a careful vetting process, including getting a recommendation from my mentor from the National Institutes of Health, Dr. Zabrecky approached me on behalf of the Marcus Foundation. At the time, I thought it was only going to be a one-time cancer study, and I was grateful just for that. So Dr. Zabrecky, who was the medical liaison at the time, called me and said that they wanted to do a clinical trial on vitamin C in cancer patients, and would I be interested? I was, of course. I wasn't sure what the Marcus Foundation was, and I didn't know who Bernie Marcus was. And then they asked me, well, have you ever heard of Home Depot? And I said, sure. And they said, well, he's one of the 3 co-founders. And so at the time, he had retired as the chairman of the Board of Trustees of Home Depot and started his own foundation where he gave a lot of his wealth to that foundation so that he could help different causes throughout the country and the world. And one of his interests and passions was this model of integrative medicine that was really in its formative years. And I'll never forget this moment when they were visiting that Mr. Marcus took me aside and said, you know, I see what you're doing here, and we're going to do big things together. And at the time I thought he was talking about this vitamin C study that they had just funded. And I said, yeah, I think the study is going to be great and so on. And he just smiled at me and said, bigger. Little did I know the vision that he had, that I soon became a part of, to really create something special and to start the first ever department of integrative medicine and nutritional sciences at a U.S. medical school, and the tremendous Marcus Institute that all of the activities we do at Jefferson encompasses. And from there, it's just been the most amazing journey, and I'm really fortunate to have been a part of it.
It was just an incredible moment in medicine that will always be remembered. And Marcus recognized it, it's what he wanted. And I think we in the background never thought it was going to happen, and perhaps including yourself. But you did, you made it happen. So here we are today with a phenomenal facility, phenomenal doctors, phenomenal research program, phenomenal academic program, and we're leading the way for the next generation of doctors.
So with a lot of patients is that they come in and they feel that they have done everything that they can do, and they are trying to change so much and do so much. And really they need someone to guide them in this open sea of options that you can do to take care of yourself and optimize your health. And watching our physicians here help those patients navigate that, and for those patients to then walk out feeling that they've been taken care of, that they have answers to their questions that may not have been answered before. For me, that's been really impactful to watch as a provider, because I don't think it's something I saw regularly when I was in residency.
I love my job. I love being able to help patients really improve their quality of life and knowing that we're really getting to the root cause of their problems.
What I love that I'm able to offer here is just more time to patients, that we can just offer more resources and more ability to dive into the literature and keep up to date with and engage in programs like this so we can keep our patients up to date on what is the most relevant advice.
I will be a Global Mental Health Fellow through UCSF. And so it's going to take me to Nepal for the next 6 months. And then after that, I will be in Chinle, Arizona at Navajo Nation for 6 months later.
What's happened in the United States is a disconnect between medicine and health. And the people who suffer from that are the citizens of our country. Health and medicine have become separated because of many factors, many forces, the insurance model, which means visits have to be very short, so that primary care medicine has become more about putting out fires. And we need those people putting out those fires, whether it be a raging strep throat or somebody who's about to go into cardiac arrest. But then the rest of health, what prevents people from getting in that place in the first place, and what prevents people from having another episode, what helps people to turn the corner from a state of illness to a state of health, that's been cut out of medicine. And that's what integrative medicine is here to restore. This mini-series was intended to inform and excite you, our viewers, about a transformation in healthcare that is starting to really take hold. It was important for me and my team to tell people about it so they could be empowered with the new options for health recovery and even longevity. We have been telling the story through the lens of the Marcus Institute, though it is important to note that there are many organizations and individuals making significant contributions to this healthcare revolution. I am humbled to have a role in this important movement, but I am just one spoke in that wheel, which wouldn't exist without the vision and support of Bernie Marcus and the incredible leadership at Thomas Jefferson University, who took a chance in embracing a novel idea, and they continue to help cultivate and support it today. My deepest gratitude to the patients who bravely agreed to be filmed and share their health journeys with us. That's not an easy thing to do. Our patients are my inspiration when I go to work every day, and I plan to continue to get the word out there. So if you're interested in updates on what we are doing, go to the Marcus Institute website and ask to be put on our e-newsletter mailing list. That's Marcus Institute at jeffersonhealth.org. Methylation. It's this buzzword that everybody's hearing about, but what is it? Did you know that while Ozempic, Wegovy, and similar drugs can be a powerful tool for managing type 2 diabetes and supporting... Also, for more content and interviews with experts in the field, follow me on YouTube at Dr. Dan Monti. Thank you so much for joining us. I'm Dr. Dan Monti. Until next time, be well.